everyone. Today we are going to talk about a very important and relevant topic in today's scenario, which is mucormycosis or black fungus. It was desired by our Guru Dev, our founding chairman of Mantana Healthcare Foundation, that I should make a video, information video on this relevant topic of mucormycosis, so that people around, can get rid of the fear, rather get some knowledge and awareness regarding the same. So what is black fungus? I am getting so many calls from my patients, my friend circles, in the relative circle, that Sumit, please tell us something about the black fungus, which is a kind of virus which has emerged. So I want to state clearly that black fungus or mucormycosis is not a virus. It's not a new virus. Some people are thinking that this is a third mutant of the corona COVID-19 virus. It's not. It is completely a different entity, and it's a fungus, not a virus. So is it a new entity? So mucormycosis was always present. It's not a new disease. It was very much prevalent in immunocompromised states like HIV, AIDS, diabetic mellitus, patients on chemotherapy who were suffering from cancer were on chemotherapy, and other diseases which compromise the immunity of the patient. It's a ubiquitous organism. I mean, it's living free in the existence, and you can find the black fungus in the soil, mud, air, and damp water. Everywhere it is present. It affects the human body only when our immunity is compromised because of various reasons. So I would rather stick to the ICMR, which is Indian Council of Medical Research guidelines, and these are issued by the Ministry of Health and Family Welfare, Government of India. So what we should do, identifying the early signs and symptoms of the mucormycosis or black fungus are very much crucial to prevent the advanced damage to the human body. So we should understand and be aware of these subtle signs and symptoms, and we should report to our nearest ophthalmologist or ENT specialist or a physician for these symptoms and get the treatment started as early as possible. So, identifying symptoms, ensuring timely diagnosis and efficient management of the patients developing mucormycosis while recuperating from COVID-19 are very much essential. First, we should understand that what are the risk factors of this disease. Is it that every patient who is recovering from COVID-19 disease? So first we should understand the risk factors which predisposes any person recovering from COVID-19 disease who can develop mucormycosis. So first and foremost, the people with uncontrolled diabetes mellitus who are unable to keep their blood sugar levels within the normal range, persons with comorbid conditions like who are taking immunosuppressant steroid medications to manage their pre-existing illnesses as well as COVID-19 over an extended length of time. They are being treated in the intensive care unit ICU, have history of ventilator and oxygenation therapy of more than a week. Having a vulnerable immune system that is weakened owing to the comorbidities such as previous organ transplants, surgeries or cancer therapies, and they're already taking some prescription antifungal drugs like voriconazole to combat the infection. It is seen that taking the voriconazole increases the risk of developing mucormycosis. So what are the symptoms of mucormycosis or black fungus which we should understand, and what are the signs? So in addition to constantly monitoring the COVID-19 patients with the above mentioned predisposing risk factors who are on treatment, we should also keep an eye out for the indications of mucormycosis. So sinusitis with congestion of the nostrils and bloody or blackish mucus emission, which is foul smelling from the nose, is a sign or a symptom of a developing black fungus or mucormycosis. Pain on one side of the face, cheekbones, and lack of sensation or bulging over the face tissues. A prominent blackish discoloration of the bridge of the nose or the nostrils. Blurring of vision with double vision or eye pain or bulging of the eyes, redness, congestion, and sudden developing of redness and watering from either of the eye may be the first sign and symptom of black fungus. Abnormal blood clotting or thrombosis of the tissues along with skin injury and damage and necrosis of the dermal cells, and sometimes you can find a black eschar, kind of a black scarring around the mucous membrane of the nose or the conjunctiva or some skin tissue. This is also a sign of mucormycosis. Further up, if the patients who is recovering from the COVID pneumonia, the COVID disease, or the respiratory functions develop sudden chest pain, excess of the fluid builds in the lungs called pleural effusion, coughing up of the blood, which we call hemoptysis, is a telltale sign of developing. So how do we manage a case of mucormycosis? So I think it has been very much clear now in our minds that identifying the risk factors, identifying and reporting the earliest signs and symptoms of the disease are the key to the management. And when the diagnosis of mucormycosis is confirmed by your attending physician, ENT specialist, or an ophthalmologist, then immediate treatment strategy is to prescribe the antifungal medication. And there is a drug called liposomal intravenous amphotericin B. It's a very effective drug which has been used for treating mucormycosis. The other treatment options like surgical debridement of the necrotic tissue of the eschar, cleaning of the sinuses, or maybe surgical removal of the eye or the sinuses, or lobectomy of the lungs. These are dependent upon the stages of the mucormycosis. A multidisciplinary approach is always needed. We need a team of a microbiologist, internal medicine expert, neurologist, ENT specialist, ophthalmologist, and a dental surgeon in a maxillofacial procedures. A plastic surgeon and a biochemist is also needed. Thus, urgent medical care by a team of doctors is usually required. What else we can do? I think the monitoring of the vitals, including blood pressure, and most importantly, the blood sugar levels, is of utmost importance. Even after the COVID patient has become negative, it is imperative that we should regularly check the blood sugar level, and we should take care of any spike in the blood sugar levels. Other thing, we should not consider any nasal congestion, nasal blockage, or sinusitis as a normal bacterial sinusitis, and we should immediately report these signs and symptoms to our physician. Thirdly, if we develop any eye congestion, watering, haziness, double vision, or swelling around the eye with history of these risk factors, then we should not neglect these signs and symptoms and promptly report to your treating ophthalmologist. The prevention is always better than the cure, and we have already understood what are the risk factors of developing mucormycosis, what are the signs and symptoms, what are the telltale signs, and what are the management options we have for managing this deadly disease. So there are simple preventive measures to go a long way in lowering the chances of acquiring mucormycosis post COVID-19 recovery, such as ensuring the personal hygiene by taking bath daily, scrubbing the body thoroughly, particularly after returning home from work, working out, or visiting anyone, wearing face masks, face shields when going to the dirty, polluted environments such as construction sites or in somewhere where there is wind and dust. Making sure to fully cover your body with the clothes, long pants, long sleeve shirts, gloves while coming in contact with soil, moss, manure, likewise in some gardening activities. To conclude, I will again recapitulate the evidence-based advisory in the time of COVID-19 issued by the ICMR and Ministry of Health and Family Welfare for the screening, diagnosis and management of mucormycosis. Mucormycosis is a disease which is caused by a free living organism in an environment called black fungus. These can lead to serious disease with warning signs and symptoms like pain and redness around the eye or nose, fever, headache, coughing, shortness of breath, bloody vomitus or sputum, altered mental status. The predisposing or the risk factors are uncontrolled diabetes mellitus, immunosuppression by steroids, prolonged ICU stay, history of prolonged oxygenation therapy, comorbidities like post-transplant malignancy and voriconazole therapy. On this point, I would stress that some people, what they are doing, that they are following a treatment regimen they are following the treatment regimen which is and they are forwarding to the community a fixed regimen which is not individual specific, and there is inadvertent use of steroids which are not needed. We all know that the steroids are not needed in a mild COVID illness. Those who are recovering well, asymptomatic patient, do not require steroids, and the inadvertent and excessive use of steroid medications, self-medications of steroid, is becoming the main risk factor for prevalence of mucormycosis in today's time. So we should refrain ourselves from self-medication, and we should monitor our blood sugar level and take advice, personal advice on telemedicine or in any way from a physician who knows better that what treatment we need for our illness. Then how we should prevent? We should use mask if we are visiting a dirty construction sites, while gardening, maintaining personal hygiene, washing hands, washing face, etc. And when to suspect that we are developing a black fungus? Again, in a recovering COVID-19 patient, diabetics or immunosuppressed individuals, if we have sinusitis characterized by nasal blockage, congestion, nasal discharge, blackish, bloody, foul-smelling discharge, local pain on the cheekbone, one-sided facial pain, numbness, blackish discoloration or eschar over the nasal mucosa and eyes, toothache, loosening of the teeth and jaw pain, blurring of vision, double vision, redness, congestion and watering from the eye, chest pain, pleural effusion, hemoptysis and worsening of the respiratory symptoms while recovering. They all pinpoint towards the mucormycosis. The do's and don'ts. The do's are control your blood sugar level, monitor blood glucose level even after you are RT-PCR negative. Use steroids judiciously, do not do self-medication. Use clean sterile water for humidifier if you are giving oxygen therapy to the patient in your household. Use antibiotics, antifungals like voriconazole judiciously. Now the don'ts. Do not miss the warning signs and symptoms which have been explained. Do not consider all the cases with blocked nose as a case of bacterial sinusitis, particularly when there is a history of immunosuppression, history of oxygenation, history of ventilator, and history of prolonged ICU stay. Do not hesitate to seek aggressive investigations like KOH mount straining and special fungal cultures, and do not lose crucial time to initiate treatment for mucormycosis. We all should know that the early diagnosis and treatment of mucormycosis has good prognosis. Otherwise, in the later stages, this disease can cause permanent blindness, disfigurement of the face, and even death in very, very severe cases. Thank you so much for your patient listening. I request you to go and get yourself vaccinated for COVID-19. Both the vaccines, Covishield and Covaxin, are equally efficacious and very much safe. I wish you a very happy and healthy life. Stay home, stay safe.